Today, we're talking about vascular health. You know, we've all heard of heart disease, but what about vascular disease? Today, we're going to talk with interventional cardiologist Dr. Tony Doss. He's on the medical staff of Texas Health Presbyterian Hospital, Dallas, about what vascular disease is and steps that you can take to prevent it.
Welcome to the Being DFW podcast. Each week, Scott Sams will cover a different topic on improving health and well-being in our North Texas communities. He will host interviews with physicians on the medical staff of Texas Health Hospitals.
Hi, I'm Scott Sams. Thanks for joining us today. According to the American Heart Association, heart disease is the leading cause of death in the United States, and it has been for a while. Well over 500,000 people die each year because of it. But how can you avoid being one of those statistics? It starts with vascular health, which is what we'll be discussing with our guest today. His name is Dr. Tony Doss. He is a board-certified interventional cardiologist who specializes in non-surgical therapy for heart and peripheral vascular disease. That's a mouthful, Doctor.
It is.
Thank you for being with us today.
You're very welcome.
Let's talk a little bit in the beginning about the difference between heart disease and vascular disease. What is the difference?
It's interesting because there's actually just a continuum. As people think about cardiac disease, they think about, if my heart has blockages or if I have a heart rhythm problem or if I have a weakened heart. But they really don't think about the fact that the heart really supplies blood to all their other organs, including their kidneys, their legs, their brain. And all of those organs also have arteries, and those arteries have health that's affected by the risk factors that cardiac disease also is affecting the heart. So people need to be thinking about the fact that their entire circulation system or their vascular system is actually affected by the same things that cause heart health to be in poor condition as well.
What causes vascular disease?
So it's a whole continuum of things, but the risk factors that are typical for heart disease, like smoking, high blood pressure, high cholesterol, family history, those all are the same types of risk factors that vascular patients have as well. In fact, over 50% of patients that have vascular problems have cardiac problems, and the opposite is also true. So when you're diagnosed with one, it's very possible that you may have the other. So when we screen patients that have significant cardiac issues, we often will be looking for other vascular territories that might be of interest as well.
Can you tell me if this is true? Do men have more symptoms that are obvious than women?
Well, certainly what we know from our experience and from the literature is that men have a tendency to express those symptoms and consider them as cardiac symptoms, for instance, chest pain, shortness of breath, fatigue, whereas women, I guess women are just tougher than we are, right?
Oh, they are, yeah.
So they have a tendency to underplay or kind of downplay those symptoms, and when they feel chest pain or pressure, cardiac symptoms, or even leg pain from vascular symptoms, they may just think that that's being tired or fatigued or something other than cardiac. It might be GI or other things that they just sort of discount, and so the symptoms can be different.
So it is preventable? Is it preventable?
Well, for the most part, there's a lot of preventable primary and secondary risk factors. We talked about them, right? Can you stop smoking? Yes. Can you reduce your cholesterol? Yes. Can you change the way your blood pressure is? Yes. Can't change your family history, of course, but I think that if you manage all those other things, and diabetes is also part of that whole list of things that causes these cardiovascular conditions to occur, those can all be managed and can lead to a long, healthy life.
You know, I went through a angiogram a few years ago, and they took a camera and they went from my wrist all the way up into my heart. The technology has advanced amazing. It's amazing how fast.
So I just finished 3 procedures this morning for very similar types of things. You can either come through the wrist or the artery that's in the groin, the femoral artery. Mm-hmm. And essentially it's not a camera that's going up, but it's a small tube which is connected to a catheter that has dye in it. You inject the dye, and that catheter is then brought to the artery that you're trying to inject it into. And then that dye is imaged under an X-ray camera. So it looks like the camera's inside of you, but actually the camera's outside.
How can someone be proactive about vascular health?
It's a great question. There are a lot of screening opportunities, and if you have the risk factors like high blood pressure, high cholesterol, smoking history, or family history, then just identifying those risk factors is a really big step. The second thing is certainly if you have symptoms, not to downplay them and just consider them to be, oh, that's not my heart. That could be something else. And I think that the third thing is that getting regular screening done just through your primary care physician who could identify those risk factors could then refer you to further testing if necessary.
Sure. Just a few months ago, I had a little scare. I felt a little dizzy. I thought I felt a little tingling in my arm. So I left the radio station and went immediately to the ER, and they checked me out, and I was okay. They said I had some little bug or something. That was probably why I was dizzy. But you can't take those things for granted. I mean, if you feel like there's a possibility, you need to go, right?
There's no doubt. I think that, it's really better off that you're a little bit proactive as opposed to being non-proactive or reactive. Mm-hmm. And, sometimes that could be life or death for somebody. If they come in with symptoms they think are really no big deal, then we can actually then reassure them. And a lot of times what we find is that they have other conditions that may not have necessarily been what they came in for. So your weakness or dizziness may not have been a cardiovascular problem specifically, but it could turn out that you do have risk factors and potentially, your carotid arteries or some other circulation problem could be addressed and risk factors managed, which would improve your overall health and condition anyway.
How is vascular disease treated for someone who's already had a diagnosis?
Sure. So it depends on which territory we're talking about. So if you go from the head to the toe, obviously if you have blockage in the neck arteries, the carotids that supply blood to your brain, either medical therapy to reduce the actual plaque buildup, blood thinners, which help any clot formation. Those are sort of on one side. And then stent therapy to open up the artery and scaffold it open, or even surgical therapy. So there's a whole spectrum of things that you can do once you're identified with it. But then as you go further down the body, kidney artery blockages can lead to high blood pressure. Those can be treated with stents. Vascular problems in the lower extremity, patients with diabetes and other risk factors can have non-healing wounds and problems with blockage there, which can be opened up with balloons or other types of stents or lasers or surgery even. So I think that just identifying where the location of the problem is and the severity of the symptoms helps define what the therapy ought to be.
A couple of minutes ago, we talked about the advanced technology that we've seen in the past few years, past 20 years. You've been practicing for a long time. Let's talk about that briefly. What have you seen? What has impressed you the most in the treatment of vascular disease?
Well, I think the thing that's really changed so much is that our access to the body by using catheters that are smaller and smaller and miniaturizing them have allowed us to treat more complex disease. So we can now treat aneurysms. I can put a stent in you to fix an aneurysm in your aorta that used to require surgery. We can put stents or clean out arteries in your legs if you have blockage and have non-healing wounds or ulcers. We could use those same type of small miniaturized devices now to actually change out or improve the circulation if you have a narrowed valve using a specific procedure called TAVR. I mean, there's just now the miniaturization of these devices allow these now to be really outpatient therapies almost.
It's funny you say that. My mother-in-law last year had an aneurysm, and she went to the hospital, and she only stayed one night, and she's 84 years old.
Right.
It's amazing what can be done now.
Well, the 4 cases I did this morning, 3 of them are going home in 4 hours. The ability for patients to leave the hospital with what is considered a pretty significant procedure is pretty advanced now.
A doctor for patients who have been diagnosed with vascular disease, how do you recommend they best coordinate their cardiac and vascular care if they have multiple specialists?
Absolutely. It's a great question. I mean, I think the first thing is to make sure that the specialists are actually speaking to each other and communicating, and also to understand what the scope of treatment is for the individual physicians that you see. There are some cardiologists that have very extensive experience with vascular disease, like myself and others. And then there are others who really do focus on the cardiology side, and then they refer the vascular. But in either case, I think that, kind of getting the global vascular opinion is an important part of your overall care. So if you're seeing just one or the other and you have both conditions, you want to make sure that they're actually coordinating with each other. And most importantly, that the risk factors are being modified and managed. So if you have carotid disease or if you have lower extremity arterial disease and you're not seeing someone who's really managing the cholesterol, the high blood pressure, the diabetes, the smoking, then I think that you probably need to have kind of a global specialist when it comes to that. Otherwise, you're really only treating kind of the symptomatic part and you're not really treating the preventative part.
Exactly. If someone was considering someone younger is listening right now, they're considering wanting to go into medicine, specifically in your specialty, what do you tell them?
Do it. I think that, there's one of the most rewarding fields that there is. There's nothing more rewarding than taking care of somebody, having the calling to actually improve their health. And, so many of our patients are so grateful for what you do for them. I think it's been a long and really rewarding career. So I wouldn't let all the things that you read about, doctors are disgruntled or there's too many regulations or this, that, or the other. I mean, it's a great field. I'd choose it again.
It's very fulfilling, I would imagine.
Yep, absolutely.
Yeah.
I tell my grandson to do it.
Really? You don't look old enough to have a grandson. Well, that'll do it for today. We want to thank Dr. Doss for joining us. Doctor, thank you so much. We appreciate it. Texas Health, partnering with you for a better North Texas. To hear more Being DFW podcasts, just visit the station's website. You can also subscribe to our podcasts on radio.com.
To hear more Being DFW podcasts, visit the station's website or go to local podcasts at radio.com and subscribe to Being DFW.